Mevra Sharath had been cleaning the suture tray when the lights in Ward 6 went out. Not the emergency lights. Those held, the amber strips along the floor pulsing their quiet, persistent rhythm against the steel-gray deck plates. The overhead surgical arrays went dark, though, all 12 banks simultaneously, and the sterilization field that kept the operating suite sealed collapsed with a soft hiss that she felt more than heard, the pressure differential shifting against her eardrums like a door being opened in a sealed room. She set the tray down. The instruments clinked against each other. 12 scalpels and 4 retractors and the Vothany bone saw she had requisitioned 3 weeks ago and was still learning to calibrate. Around her, the Tenmurray Provincial Medical Station hummed with the residual vibrations of a facility that had been running at 92% capacity for the last 14 months. Every ward full, every surgical bay scheduled, every bed occupied by someone who had come to the frontier, because the Hegemony's expansion wave had deposited them, and they had nowhere else to go. Mevra was the station's senior trauma surgeon. She had held the title for 9 years, which was long enough to know that when the overhead arrays dropped without warning, something structural had failed, and when something structural failed on a station this old, the cascade was already underway. The emergency channel on her wrist comm crackled. All medical staff, this is Station Director Peleth. We have a primary reactor fault, coolant breach in the lower engineering module. Emergency shutdown is in progress. All non-critical systems are offline. Life support is on reserve cells. Estimated reserve duration, 4 hours. Mevra looked at the surgical bay. The patient on the table, a Tenmurray dockworker named Rithais who had crushed 3 vertebrae in a cargo handling accident that morning, was unconscious under sedation, his broad gray-green torso rising and falling beneath the sterile draping. He needed another 40 minutes of surgery. The bone saw required a sterilization field. The sterilization field required power that no longer existed. She keyed her comm. Peleth, this is Shorath. I have an open patient in Bay 3. I need a portable sterilization unit and a backup power cell for the surgical array. Acknowledged, Shorath. We're rationing reserves. I can get you 1 portable unit, 20 minutes. Rithais can't wait 20 minutes with an open spinal column. 18, that's the best I can do. Mevra closed the channel. She looked at her surgical assistant, a young physician named Terran Das, who was standing on the other side of the table with his hands still gloved and his eyes very wide. Close the wound, she said. Temporary sutures. We stabilize and wait for the portable. The alignment won't hold if we lose him to infection first. Close it. They closed the wound in 9 minutes, working by the amber glow of the emergency strips, Mevra's hands finding the familiar geometry of Tenmurray spinal architecture by touch as much as sight. Terran held the retractors steady. His hands did not shake, which Mevra noted with approval, because she had neither the time nor the temperament to manage another person's nerves while she was managing an open spine. The station shuddered, a deep, structural tremor that vibrated through the deck plates and up through the soles of Mevra's surgical boots, the kind of tremor that did not come from a simple reactor fault. It came from something failing at a level that reactor faults were not supposed to reach. The emergency channel again. Peleth's voice, and now the comm was thinner. The professional composure stretched over something Mevra recognized because she had heard it in her own voice during the Solène triage, 6 years ago, when a transport collision had sent her 900 wounded in a station designed for 300. All staff, the coolant breach has reached the secondary containment ring. We are evacuating decks 7 through 12. Medical, begin triage for patient relocation. We have approximately 3 hours and 40 minutes of reserve life support. I have transmitted a Priority 1 distress call to the Hegemony sector fleet at Vorenthal Station. Mevra pulled her gloves off. She looked at Terran. How many patients in the surgical wing? 41. 14 in critical recovery, 9 in pre-op, 18 in the general ward. The 14 critical cases can't be moved without powered life support cradles. No. And the power for those cradles just went offline. Terran said nothing. He did not need to. Mevra could see him doing the same calculation she was doing, the one every medical professional on the station was doing at this moment. Patients versus resources, time versus distance, the gap between what was needed and what was available. Terran had been her assistant for 3 years, long enough to have learned that the gap was not an abstraction. It was the space where people died. Mevra walked to the corridor. The Hegemony Provincial Medical Station was not a military installation. It was a frontier medical facility, built 67 years ago when the Hegemony's expansion wave first reached the Hegemony reach, and it had been patched, expanded, understaffed, and overworked every year since. The corridors were narrow, their alloy walls scuffed and dented from decades of gurneys and equipment carts. The ventilation system wheezed through ducts that should have been replaced a decade ago. The gravity generators had been recalibrated so many times that the pull varied by as much as 3% between decks, enough to notice if you carried a full surgical tray and paid attention to the way the instruments shifted. Mevra had spent 9 years learning this station's rhythms, its quiet complaints, the way it settled into its own weight during the night cycle when the patient load was lowest and the generators could rest. She knew which deck plates vibrated at what frequency when the gravity generators cycled, and she knew which ventilation duct produced a faint whistle on the night shift when the air pressure differential shifted between decks 3 and 4. She had memorized the station's acoustic signature the way other surgeons memorized anatomy, because in a facility where equipment failed regularly, your ears told you things before your instruments did. She knew the sound of a healthy station. She knew the sound of a station that was failing. What she heard now was the latter, a low, grinding vibration from the lower decks that the station had never made before, the sound of containment systems working harder than they had been designed to work. The station had been built for 140 patients. It currently held 217. The overflow had started 8 months ago when the Hegemony closed the Peloton Clinic on the far side of the reach, redirecting its patient load to the only remaining facility within transit range. Mevra had written 3 formal complaints about the overcrowding. The Hegemony's Provincial Health Authority had responded to each one with the same carefully worded acknowledgement that managed to contain neither a solution nor an apology. The third response had included a suggestion that Mevra consider implementing flexible bed allocation protocols, which she had interpreted correctly as permission to put patients in corridors if necessary. She had not put patients in corridors. She had instead converted 2 storage rooms and the station's secondary observation lounge into overflow wards, furnished them with surplus equipment she had requisitioned from a decommissioned research station in the Peloton sector, and staffed them with nurses she had hired on personal authority, paying their salaries from the station's maintenance budget, because the medical budget had been frozen for 2 fiscal cycles. Peloth had signed the paperwork without reading it. They had an understanding, Mevra and Peloth. He handled the Hegemony. She handled the patients. The arrangement worked as long as neither of them examined it too closely. Around her, the station's medical staff was beginning the triage. Nurses moved patients on portable gurneys through the dim corridors, guided by the amber emergency strips, their voices low and controlled. A respiratory therapist named Chelov was manually ventilating a patient whose powered respirator had died with the overhead systems, his broad hand squeezing the resuscitation bag with the metronomic rhythm of a man who understood that stopping meant the patient stopped too. 2 orderlies were carrying a sedated child from the pediatric ward on a stretcher designed for adult Hegemony, absurdly oversized for the small form curled at its center. A triage nurse named Kethri was marking patient tags with colored tape under a handheld light, sorting the walking wounded from the critical, her voice calm and her movements precise, and her eyes carrying the same look Mevra had seen in the mirror at the Solène, the look of someone who was doing the work, because the work had to be done, and there was no one else to do it. This was Mevra's world, not the politics of the Hegemony's expansion, not the fleet deployments or the diplomatic channels. The bodies, the breathing, the quiet arithmetic of who could be saved and who could not, performed in her head with the steady, merciless precision that 9 years of frontier surgery had trained into her. 41 surgical patients, 14 critical. 3 hours and 40 minutes of life support. Vorenthal Station, the nearest Hegemony fleet base, was 6 hours away at best response. Peleth had sent the distress call there because Vorenthal was their designated rescue authority, the place the protocols pointed, the name on the emergency binder that sat in every station director's office throughout the Tenmarie Reach. Mevra did the math: 6 hours for rescue, 3 hours and 40 minutes of air. The arithmetic was not complicated. It was not survivable. She keyed her calm, Peleth. Go ahead. The critical patients in the surgical wing need powered cradles. Without them, I lose the 14 in recovery within 2 hours. The 9 in pre-op can survive on portable oxygen, but they need thermal regulation. How many reserve cells do we have? 12 portable cells. Each one runs a single cradle for approximately 90 minutes. 12 cells, 14 patients. I know, Shoreth. Then you know I need 2 more cells, and I need all 12 right now. I'm allocating reserves to every ward simultaneously. Pediatrics needs 6 cells. The geriatric wing needs 4. Obstetrics has 2 patients in active labor who need monitoring. Peleth, the 14 in my surgical recovery will die without powered support, not degrade, die. A long pause. I'm sending you 8 cells, that's what I can spare. You'll have to rotate them. 8 cells, 14 patients, 90 minutes each. Rotate them, Shoreth. I don't have a better answer. Mevra closed the channel, 8 cells. 14 patients, 90 minutes per cell. If she rotated them in pairs, she could keep 7 patients on powered support at any given time, while the other 7 waited on portable oxygen and manual ventilation. Each patient would get approximately 45 minutes of powered support per 90-minute cycle. Whether that was enough depended on the patient, the injury, the metabolic rate, the resilience of a Tenmarie body to the specific insult it had suffered. For some of them it would be enough, for some of them it would not. Mevra began the triage, not the emotional kind, not the version that civilians imagine when they thought about doctors making impossible choices, the clinical kind. The kind she had learned at the Solène triage 6 years ago, when the transport collision had overwhelmed her staff, and she had stood in a corridor not unlike this one, and sorted 900 people into categories with a system that had no room for hope and no patience for grief. Category 1, the patients who would survive the rotation schedule with minimal intervention. 7 of the 14. Stable vitals, injuries managed, their bodies strong enough to tolerate the gaps in powered support. Category 2, the patients who might survive if the rotation timing was precise and the portable oxygen held. 4 of the 14. Their margins were thin. A delay of 10 minutes in the rotation could push them past the line. Category 3, the patients who would not survive the rotation schedule regardless. 3 of the 14. 2 with massive internal injuries that required continuous powered intervention. 1 with a respiratory failure so severe that even the powered cradle was barely holding the line. 3 patients she could not save with 8 power cells and a 90-minute rotation. She looked at the names and made herself remember them. Not the clinical designations, not the cradle numbers, but the names. Dalla Veneth, Cos Trevin, Little Pethai. She had learned at the Solène that the moment you stopped seeing names and saw only numbers was the moment the triage became something other than medicine, and she had promised herself that she would not let that happen again, even when the numbers were the only language that could save anyone. The Category 3 list was the hardest thing she had written since the Solen. 3 names, 3 people she was professionally acknowledging she could not save with the resources available. 3 entries in a column that no training manual had a good name for, because the name that fit was not one that anyone wanted to say aloud. She organized the rotation chart on a handheld display, marking each cell's charge level, each patient's tolerance window, each transition point. The display screen was dim on emergency power, and she had to tilt it to read the numbers. The numbers were not good. They were the numbers she had. She assigned Terran to the Category 2 patients, assigned Chelov to manual ventilation of the Category 3 patients, and pulled 2 additional nurses from the general ward to handle cell swaps at the corridor junction between cradle groups. She was positioning the first cell on cradle 4 when her comm crackled with a voice she did not recognize. Not Peleth, not any of her staff. A voice speaking Terran standard, flat and unhurried on a frequency that should not have been active. Hegemony Provincial Medical Station. This is the Terran medical ship Alder Vane, Commander Jessamine Coates. We are reading your emergency beacon on our long-range sweep. We are adjusting course to your position. Estimated arrival, 47 minutes. Mevra stared at her comm. The Hegemony reach was not Terran space. The Hegemony's distress call had been aimed at Vorenthal Station, 6 hours away, on the Hegemony's own secure military band. There was no Terran relay in the sector. There was no mutual defense agreement. There was no mutual aid protocol. There was no reason for a Terran vessel to be monitoring the Hegemony provincial band, and there was certainly no reason for a Terran medical ship to be within 47 minutes of a Hegemony frontier station. She keyed the reply. Terran vessel Alder Vane. This is Senior Surgeon Mevra Shorath, Hegemony Provincial Medical Station. Confirm you received our distress call. Negative, Doctor. We received your emergency beacon. Standard automated pulse, wideband, unencrypted. Your beacon is broadcasting on a frequency that overlaps the lower edge of the Terran emergency medical band. We caught it on a routine sweep. Mevra looked at the wall display showing Peleth's transmission log. The Priority 1 call had gone to Vorenthal Station, encrypted, Hegemony military band. That was the deliberate transmission. But the station's automated emergency beacon, the one that activated independently when life support dropped below critical thresholds, broadcast on a wideband, unencrypted pulse that had been calibrated 67 years ago when the station was built. 67 years ago, when the Hegemony reach had been a contested border zone, and the frequency allocations had been different, and nobody had updated the beacon's broadcast parameters since, because nobody had expected the station's emergency beacon to ever activate. The beacon was broadcasting on a frequency that overlapped the Terran emergency medical band, an accident of old calibration, a frequency nobody had thought to update because the station was a Hegemony facility, and the Terran band was irrelevant to Hegemony emergency protocols. Except that a Terran medical ship had heard it. Alder Vane. Be advised, we have a coolant breach compromising our lower decks. Life support is on reserve with approximately 3 hours remaining. I have 14 critical surgical patients who need powered life support cradles, and I do not have enough reserve cells to maintain them. We have over 200 patients station-wide. Our designated rescue authority is 6 hours out. A pause, 4 seconds. Then Coates' voice, carrying a sharpness that cut through the flat Terran register. Dr. Shorath, the Alder Vane is a Terran medical response vessel. We carry 42 portable powered life support modules, a full surgical suite rated for cross-species trauma, 6 operating bays, and a medical staff of 111. We have supplies for 200 patients for 72 hours. Mevra stood in the corridor and did the math again. 42 powered modules. She needed 14. The Alder Vane carried 3 times what she needed. Alder Vane, your medical staff, are they trained in Tenmari physiology? We carry a cross-species medical database and 3 physicians with xenobiology specializations. We're pulling your species' physiological baseline and surgical protocols from our records during transit. We'll be ready to assist on arrival. You're pulling our protocols during transit. We have 47 minutes, Doctor. That's enough time to brief a surgical team. Mevra closed her eyes. 47 minutes. She had been trying to stretch 8 power cells across 14 dying patients to bridge a 6-hour gap that could not be bridged. And now a voice on a frequency that should not have been active was telling her that 42 modules and 111 medical professionals would be at her docking port before the hour was out. She opened her eyes. Confirmed, Alder Vane. We will have docking coordinates and a patient manifest ready on your arrival. Understood, coats out. Peleth's voice on the station channel immediately after. Shoreth, what was that? A Terran medical ship, 47 minutes out. They heard our emergency beacon. We didn't transmit to the Terran band. We didn't need to. The station's emergency beacon broadcasts on a 67-year-old frequency that overlaps their medical band. It's an old calibration nobody ever changed. A silence. Then Peleth, in the careful voice of a station director, confronting help from outside his protocols. The Hegemony didn't authorize a Terran response. I know. There's no mutual aid agreement with the Terran Medical Service. I know, Peleth. If I accept Terran medical assistance without authorization. Peleth? Mevra's voice was level, the voice she used in surgery, the one that carried no emotion because emotion was a luxury that operating rooms could not afford. I have 14 critical patients and 8 power cells. 3 of them will die on the current rotation schedule. All 14 will die if Vorenthal doesn't arrive in time, and Vorenthal is 6 hours out. A Terran medical ship with 42 powered modules will be here in 47 minutes. Do you want me to tell them to wait for authorization? Mevra could hear the emergency strips pulsing in the corridor behind her, and she could hear Peleth's breathing on the channel, and she knew what he was calculating. His career, the Hegemony's protocols, the diplomatic implications of accepting unsolicited medical aid from a species that had no treaty obligation to provide it. And on the other side of the calculation, 14 people whose blood oxygen was dropping, while he weighed the cost of breaking a rule that had never anticipated being tested like this. Prepare the docking coordinates, Shoreth. I'll handle the authorization after the fact. Understood. Mevra turned back to the surgical wing. The next 47 minutes were the longest of her career. Not the hardest. The Solen triage had been harder, 900 wounded in 12 hours, decisions made at a pace that left no room for second guessing. This was different. This was slow. This was watching the power cells drain on their indicator strips, counting the minutes between rotations, listening to the vital monitors cycle through their readings with the mechanical patience of machines that did not know they were counting down. The 3 Category 3 patients were the center of her attention. Dalla Veneth, a mining engineer whose internal injuries had required 3 surgeries over the past week, and whose body was holding together through the continuous support of the powered cradle and not much else. Kos Trevin, a transport pilot who had suffered a decompression event that destroyed 70% of his lung capacity, and who breathed only because the cradle's ventilator did the work his lungs could not. And the child, a 6-year-old named Pethai, daughter of a cargo handler, brought in 2 days ago with a congenital cardiac defect that Mevra had been preparing to operate on when the reactor failed. Pethai was the one Mevra watched most carefully. Children's bodies were less predictable than adults, their margins thinner and their compensatory mechanisms more volatile. A child could look stable for 30 minutes and then crash in 60 seconds, the small body's reserves exhausting without warning. Mevra positioned herself between Pethai's cradle and Trevin's, managing both on a manual rotation that required her to physically move the power cell between them every 12 minutes. 12 minutes on Pethai, 12 minutes on Trevin. In the gaps, each patient received manual ventilation from Chelov or one of the respiratory nurses, their hands squeezing the portable resuscitation bags with a steady rhythm that kept oxygen moving when the machines could not. The first rotation cycle taught Mevra the rhythm. Connect the cell to Pethai, wait for the module's cardiac support to stabilize, check vitals, watch the cell's indicator strip begin its slow descent from full charge. At the 12-minute mark, disconnect, carry the cell 6 meters to Trevin's cradle, connect, wait for the ventilator to engage, check vitals. In the gap on Pethai's side, Chelov's hands took over, steady and sure, the bag compressing at a rate that Mevra could hear from across the ward. The second cycle taught her the cost. Each transition carried a risk, the brief moment between disconnection and manual ventilation where the patient's body was on its own, the failing heart or the failing lungs doing their inadequate work without assistance. Pethai's cardiac rhythm stuttered each time the cell came off, a small irregularity that resolved within seconds when the manual support began, but that lasted longer each cycle, as if the child's heart was learning that help came and went and could not be relied upon to stay. The third cycle taught her to stop counting. The numbers were doing what numbers did in situations like this, telling a story that had only one ending if the variables didn't change. Mevra's job was to hold the story open long enough for the variables to change. The station groaned around them. The coolant breach was worsening. Mevra could smell it now, a sharp chemical edge in the recycled air that the failing atmospheric processors were no longer filtering completely. The temperature was dropping. Environmental controls, running on the same reserve cells that everything else was competing for, could not maintain the surgical wing standard 23 degrees, 21, 19, 17. The patients in the recovery ward began to shiver under their thermal blankets. Mevra sent Terran for additional blankets. There were none. He came back with emergency thermal wraps from the cargo bay, rough metallic sheets designed for equipment protection. He cut them to size with surgical scissors and layered them over the patients, working through the cradles one by one. At the 8-minute mark, one of the corridor nurses reported a cell draining faster than rated. 14 years old, manufacturing defect. Mevra swapped it and noted they were now operating on tighter margins. At the 14-minute mark, Terran reported from Category 2. Patient 9, the dock foreman, blood pressure dropping, not fast but steady. Increase his rotation frequency. 8 minutes powered, 4 manual. That shortens the cycle for Cradle 11. She's Category 1 margin. She can tolerate it, he can't. At the 20-minute mark, Dalavinith's vitals began to slide. A slow decline, the numbers descending on the portable monitor. Blood pressure falling. Oxygen saturation thinning. The internal injuries that 3 surgeries had tried to repair were leaking again, the tissue bonds failing under the stress of intermittent support. Mevra stood at Venith's bedside and made the calculation she had been avoiding. She could redirect Pethai's power cell to Venith. It would buy 30 minutes of continuous support, enough to stabilize the tissue bonds. But it would leave Pethai on manual ventilation alone, and Pethai's cardiac defect meant her heart was doing work a 6-year-old's heart should not have to do. Or she could keep the rotation. Venith would decline. The decline might be survivable if the Terran ship arrived in time. Might. How long, she asked Chelov. Maybe 40 minutes before the bleed overwhelms her circulatory reserve. And the Terran ship? 27 minutes. 13-minute margin. If the ship arrived on schedule and deployed immediately and the interface worked. She stood at the junction of 2 cradles, holding the cell that was currently running Pethai's cardiac support, and she let the calculation complete in her mind the way she let all triage calculations complete, without mercy, without evasion, with the full weight of every variable accounted for. Veneth was 61 years old. She had survived 3 surgeries. Her body had resources that a child's body did not. And the 13-minute margin, thin as it was, existed for Veneth in a way that it did not exist for Pethai, because an adult's circulatory system could compensate in ways that a 6-year-old's congenitally defective heart could not. The decision was clinical. The feeling that accompanied it was not. At the 24-minute mark, the station shuddered again, harder. A conduit in the corridor outside the recovery ward ruptured, and the sharp hiss of escaping atmosphere filled the wing. Terran sealed the emergency bulkhead from the ward side. The seal held. Atmospheric reading dropped 1.5% and stabilized. Temperature fell another 2 degrees. 15 now. Pethai's small body was curled tightly in her cradle, hands drawn against her chest, breathing fast and shallow. At the 28-minute mark, one of the power cells died completely. 14 years old, charge retention gone. 7 cells now. 14 patients. The rotation schedule that had been barely survivable at 8 was impossible at 7. Mevra chose the 2 Category 1 patients with the strongest vitals, went to each cradle, removed the cell, looked the patient in the eye and said, 19 minutes. Help is coming. The first, a woman named Sarith recovering from abdominal surgery, nodded once. She gripped the edge of her cradle with both hands and set her jaw. Mevra moved the freed cells to the patients who needed them most, recalculating the rotation on the handheld display as she walked, the amber numbers reflecting off the walls of the dim corridor. The arithmetic was still failing, but it was failing slower now. The margins measured in minutes rather than seconds, and in emergency medicine, slower failure was a kind of victory. The second, an elderly man named Voss, looked at Mevra with the calm eyes of someone who had lived long enough to understand that sometimes the decision was made for you. Do what you need to, doctor. At the 31-minute mark, Pethai crashed. The cardiac monitor shrieked and went to flat alarm. Ventricular fibrillation. The child's defective heart, stressed past its limits by the cold and the rotation gaps, had lost its rhythm. Mevra was at the cradle in 4 steps. She ripped the power cell from Trevin's cradle, plugged it into Pethai's, and began manual cardiac compression with one hand while the module powered up. 3 seconds. 5. 7. The pacer engaged. Pethai's heart stuttered, fought, and found a rhythm. Thin, irregular, but beating. Chelov was at Trevin's side, manually ventilating. Trevin won't tolerate more than 8 minutes without the cell. The ship is 16 minutes out. That's a long time without a ventilator for 30% lung capacity. It's the time we have. At the 33-minute mark, obstetrics called asking to borrow a cell. One of the labor patients was in distress. Mevra looked at her 7 remaining cells, 6 keeping 14 people alive on a failing rotation, 1 holding a 6-year-old's heart together. No, switch to manual monitoring. If she decompensates, I'll come down. She stood in the ward and looked at the cradles. 14 patients, 7 cells, 3 patients dying, 2 on manual only, a child whose heart had stopped once, a pilot breathing on borrowed air. And 16 minutes until a ship that should not exist arrived at a station it should never have heard. Mevra stood in the center of the ward and breathed. The air was cold and carried the chemical edge of the coolant contamination, and her lungs processed it the way they processed everything in a crisis, automatically, without complaint, saving the complaints for later when there would be time to feel them. She could hear Chelov's hands on the resuscitation bag, the steady rhythm that had not faltered in 16 minutes. She could hear Terran's footsteps as he moved between the Category 2 cradles, checking vitals, adjusting cells, keeping the rotation alive through precision and will. She could hear the quiet breathing of 217 patients on a station that was dying around them, and she could hear, underneath all of it, the low hum of the emergency strips, counting time. At the 35-minute mark, the docking sensors registered an incoming vessel. Terran appeared. They're here, docking in 4 minutes. 4 minutes. Veneth's blood pressure was at 64/37. Trevin was on manual ventilation, Chelov's forearm shaking from sustained effort, Pethai's cardiac rhythm holding barely. Sareth and Voss on manual only, pale and sweating, gripping their cradle rails, breathing in slow, deliberate patterns that Mevra recognized as the breathing of people who were consciously deciding to keep doing it. The Terran ship docked. The deep metallic clang, the hiss of pressure equalization, the thunk of the seal. Footsteps, many of them, organized fast. They came through the bulkhead door. Medical personnel in Terran blue carrying equipment. The first through was a woman, mid-40s, short dark hair, unhesitating stride. She carried a powered life support module on a grav sled, status lights already green, interface panel displaying a startup sequence initiated during approach. Behind her, 2 more medics with modules. Behind them, a surgical team with a portable operating suite. Behind them, more modules, more personnel, more equipment, flowing through with the precision of a response rehearsed until it became instinct. The speed of it stunned Mevra. She had run emergency drills on this station for 9 years, and the fastest her staff had ever deployed from staging to patient contact was 11 minutes. The Terran team was at the ward entrance in under 2, and they had done it while carrying equipment through unfamiliar corridors in a station they had never seen before, navigating by the amber emergency strips and the patient manifest that Mevra had transmitted during the last minutes of the approach. Commander Jessamine Coates came through last, tall, angular, eyes sweeping the corridor. Dr. Shoreth. Here. Where are your critical patients? This ward, 14 patients, 3 in immediate crisis. 1 child in cardiac distress who arrested 12 minutes ago. 1 man on manual ventilation with 30% lung capacity. 1 woman with active internal hemorrhage. Peterson, first 3 modules to the ward. Mallory, stage the rest. All 14 on powered support within 10 minutes. The remaining modules came in waves. The 4th and 5th were directed to the Category 2 patients by Terran, who had already memorized the cradle layout and guided the Terran medics to the right beds without hesitation. The 6th through 9th were staged in the corridor by a Terran logistics specialist who arranged them in order of priority based on the manifest Mevra had transmitted, so that each module was ready to be deployed the moment a medic was free to connect it. Peterson was already moving. Mevra walked beside her. First cradle on the left. Pethai, 6-year-old, cardiac defect, ventricular septal insufficiency, left ventricle at 40% of age normal. She arrested and I restarted her on an adult pacer. I have a pediatric config loaded. Pulled your species baseline during transit. The module reached Pethai's cradle. Peterson disconnected the emergency cell, interfaced the Terran module. The pediatric cardiac program engaged. Pethai's monitor steadied, each beat stronger than the last, the stuttering pattern smoothing into something that looked like a child's heart working as it should. In the corridor, the sound of the deployment was changing. The powered units were coming online in sequence, and each one that engaged was a patient removed from the rotation schedule, a cell freed for someone else. The arithmetic that had been killing them restructured 1 module at a time. Sareth, the woman Mevra had put on manual only, received a module at the 4-minute mark. She released her grip on the cradle rail and let out a breath that she had been holding, it seemed, since Mevra had looked her in the eye and said 19 minutes. Voss received his at the 5-minute mark, and when the powered support engaged, the elderly man closed his eyes and said, very quietly, "Well then." in a voice that carried the particular relief of someone who had genuinely been unsure whether they would need to keep breathing on purpose. The module's display showed Pethai's cardiac output in real time, the numbers climbing from the thin, fragile readings of a child's heart running on crisis reserves to something that looked, for the first time in hours, like stability. The pediatric calibration was precise, adjusting the support intensity in real time based on the child's metabolic rate, responding to her body's signals with a sensitivity that the adult-configured emergency cell had not been able to match. It was, Mevra realized, the difference between a tourniquet and a surgical clamp. Both stopped the bleeding. Only one of them did it without causing more damage. They moved to Trevin. Akefer connected a module. Chelov stepped back, hands cramping, forearms trembling. The powered ventilator took over. Trevin breathed on machine-driven air for the first time in 12 minutes. Veneth, the third module, connected, but the numbers continued sliding. Blood pressure 62/35. The module could not fix active bleeding. She needs surgery now. Coates was at the ward entrance, directing remaining modules. Around her, powered units engaged one after another, a steady electronic hum replacing the silence of manual rotations and failing cells. We brought a portable surgical suite, cross-species rated, self-contained sterilization field. 2 of my surgeons briefed on Tenmari abdominal anatomy during transit. The suite deployed in Bay 3. Mevra operated on Veneth with one of Coates' surgeons beside her. His name was Dr. Elias Vey. Late 50s, quiet, with the particular calm that came from having seen enough to know that calmness was a surgical instrument. He did not take over. He anticipated. When Mevra reached for a retractor, it was in his hand. When she needed a suture gauge for Tenmari tissue, he had it, selected with a confidence that meant he had memorized the equivalents during transit. When the bleeding from the liver analog surged past what she could clamp alone, his hands were there, steady and sure, applying pressure to the secondary bleeder. They had never operated together. They did not share a species, a medical tradition, or a language. What they shared was the universal grammar of emergency surgery, the rhythm of hands in a sterile field under time pressure, the coordination of 2 professionals who understood the anatomy, one from a lifetime and the other from 47 minutes of concentrated study. Halfway through the surgery, Vey noticed something Mevra had not. Dr. Shorath, the tissue bond on the medial aspect from your second surgery. It's not just failing from intermittent support. The suture material is dissolving. Mevra looked. He was right. The absorbable sutures, standard Hegemony supply, were dissolving faster than rated. The coolant contamination in the station's atmosphere had reached the bay before the sterilization field was restored, and the chemical interaction was accelerating absorption. I need a non-absorbable alternative. Vey was already reaching into the kit. Synthetic filament, rated permanent, compatible with Tenmari tissue based on the cross-reference database. He held up the suture. It was a small thing, a suture, a filament, but Mevra understood what it represented. Somewhere during the 47-minute transit, while his colleagues were memorizing vascular maps and calibrating modules, Elias Vey had taken the time to check which of the Alder Vane's surgical supplies would be compatible with Tenmari tissue. Not because someone had told him to, not because a protocol required it. Because he was a surgeon, and surgeons prepared for what they might find inside, and he had understood that compatibility would matter when it mattered most. She filed that away. It was the kind of detail that civilians never learned about emergency medicine, and that other doctors recognized instantly. The preparation that happened before the crisis, the work that was invisible until the moment it became the difference between a suture that held and one that dissolved. Mevra took it, tested the gauge, and began resuturing with material manufactured on a different world by a different species that fit the wound as if designed for it. 91 minutes later they closed. Veneth's vitals stabilized, alive, holding. Mevra stepped back. She looked at them, the broad-knuckled hands of a frontier surgeon who had not taken a vacation in 4 years, and she watched the tremor fade from the left before the right, which was always the order, because her left hand was the one that did the holding and her right was the one that did the cutting, and the cutting hand carried the tension longer. Vey was watching her hands too, not with clinical curiosity, but with the recognition of a colleague who had seen the same tremor in his own hands and understood what it cost to suppress it during the hours that mattered. "You need 30 minutes of rest, Dr. Shorath." She almost objected. She did not. He was right. "Pethai needs monitoring." "I'll monitor her personally." Mevra walked to the break room, dark, cold. No coffee dispenser. She sat and listened to the station's new sounds, Terran modules humming, Terran voices in the corridors mixing with Tenmari, speaking the stripped-down medical shorthand that crossed every language barrier. Peterson explaining module recalibration to a Tenmari nurse. The graph sled rolling more equipment from the Alder vein. 2 medical staffs becoming one, without ceremony, because the work required it. She could hear, very faintly, the sound of Vey's voice from the recovery ward, low and steady, and she recognized the cadence of a physician talking a patient through a vital sign check, explaining what the numbers meant, using the tone that good doctors used when they wanted the patient to understand without being frightened. She had used that tone 10,000 times herself. Hearing it in a Terran accent, in a ward that had been dying an hour ago, was a strange kind of comfort. Torin appeared. All 14 critical patients on Terran modules, Category 2 covered, Sarith and Voss both stable on modules now. Sarith told me to tell you she held her breath for 16 minutes. He paused. She was smiling. "Casualties?" "None, no one died." Mevra sat with that. 3 patients in Category 3. 3 she had written into the column of the dead, and 3 patients alive because a ship that should not have been listening had heard a beacon that should not have been broadcasting and had come anyway. What else are they doing? Atmospheric processors in the affected decks. Engineering staff working with Vatros on coolant containment. They brought a portable reactor, standard equipment on their medical ships. They're connecting it to supplement our reserves. A civilization that built its medical ships with the assumption that they would need to save strangers. The thought settled the way a diagnosis settled, changing everything around it. Mevra thought about the Alder Vane's equipment manifest. 42 powered modules, not 20, which would have been enough for most station emergencies, not 30, which would have covered even a large-scale crisis. 42. 3 times what a station the size of Mevra's would ever need. Because the ship had been designed not for a specific scenario, but for the worst one, and the worst one always needed more than anyone planned for. She thought about the cross-species medical database, not a Tenmari database, not a database for any single species, a database that covered every species the Terran Medical Service might encounter, maintained and updated and available on transit, so that a surgical team could brief on unfamiliar anatomy in 47 minutes and arrive prepared to assist. Someone had built that database. Someone had maintained it. Someone had decided that preparing for species you might never treat was worth the cost of maintaining data you might never use, because the alternative was arriving at a station like Mevra's and being unable to help. The Hegemony's rescue ship arrived 4 hours and 19 minutes after the Terran ship docked. By then, the Alder Vane's reactor had restored partial power. Patients were on modules. The breach was contained. Fleet Surgeon Drevith Tozel came aboard with 36 staff, and the bearing of an officer who had arrived to find someone else already doing his work. Senior Surgeon Shorath, I understand you accepted Terran medical assistance without Hegemony authorization. I did. That's a protocol violation. Mevra looked at him, 11 hours on her feet, A child's heart stopped and restarted. A woman sutured with Terran filament by Terran light. When the reactor failed, I had 14 critical patients and 8 power cells. 3 were going to die before your ship arrived. I accepted. Without authorization. My patients did not have time for authorization, fleet surgeon. Tozel was quiet. How did they hear the signal? Our emergency beacon, 67 years old, broadcasts on a frequency overlapping the Terran emergency medical band. Nobody updated the calibration. A 67-year-old beacon, broadcasting to the wrong species. And they came. Tozel looked down the corridor, where Terran and Tenmari staff worked together, exchanging notes in a pidgin of medical standards that neither had formally learned. A Terran nurse showed a Tenmari orderly how to recalibrate a module. The orderly showed the nurse where the medication storage was located. I'll file the compliance report and recommend the beacon frequency be updated. Don't. He looked at her. Don't update it. Leave it exactly as it is. She watched the understanding arrive, a frequency that overlapped by accident, an accident that saved 41 people. Beacon frequency reviewed, Tozel said, determined to be within acceptable operational parameters. Thank you. The station settled into recovery the way injured patients did, slowly, unevenly, with setbacks and small victories that accumulated over hours into something that resembled stability. The coolant breach was fully contained by hour 7. The atmospheric processors were back online at 60% capacity by hour 12. The temperature in the surgical wing climbed back to 18 degrees, then 20, then 22, and the thermal wraps came off the patients one by one, folded neatly by nurses who had cut them from cargo packaging in the dark, and who now placed them in the supply closet as if they were standard medical equipment, because in a way they were now. Torin completed Rithai's spinal surgery using the Terran portable sterilization field and reported the alignment was holding. The 9 pre-op patients were stabilized and rescheduled. The 18 general ward patients, most of whom had weathered the crisis on portable oxygen and determination, were cleared for standard monitoring. The obstetrics ward reported both deliveries successful, both mothers stable, both infants healthy, one born during the crisis and one born 3 hours after, and the midwife, a woman named Tessali who had been in the profession for 30 years, told Mevra that the second delivery was the most peaceful she had attended in months, because the Terran atmospheric processors had made the air in the ward cleaner than it had been in years. In the recovery ward, Vey was beside Pethai's cradle, explaining the module's readout to the child with the patience of a man who had nothing more important to do. He had been monitoring her cardiac rhythm for 3 hours, documenting each flutter, cross-referencing the Tenmari pediatric database, preparing recommendations for corrective surgery. Coates appeared beside Mevra. Full power in 18 hours. We'll keep our modules deployed. Your ship has other assignments. Our assignment is wherever the patients are. You heard a beacon that wasn't aimed at you, on a frequency that overlaps yours by accident. You briefed your staff on an unfamiliar species in under an hour and arrived with exactly what we needed. That's the job. Mevra looked at her. Coates stood in the corridor of a Hegemony station that she had no treaty obligation to assist, having deployed her ship's full medical complement for a species she had no formal relationship with, because a sensor sweep had caught a signal that was not addressed to her. The Terran commander's face was tired and composed, and entirely without self-congratulation. No, Mevra's voice was quiet and certain. The job is your people, your frequencies, your space. This was someone else's emergency heard because a 67-year-old calibration leaked across a band nobody thought to check. Coates was quiet for a moment. Dr. Shorath, 4 years ago I lost a station. Terran research outpost Palari Drift, reactor failure like yours. We were 2 hours out. We arrived to find the medical officer had been rotating cells for 90 minutes alone. She saved 19 of 23. The 4 she lost because the cells ran out 12 minutes before we docked. A pause. 12 minutes. I have carried those 12 minutes for 4 years. When my sensor officer flagged your beacon on a frequency my standing orders don't require me to monitor, I did not have a conversation about jurisdiction. I changed course. Because of 12 minutes. Mevra looked at her. She saw, in Coates' face, the same thing she had seen in her own mirror after the Solène triage. The weight of a number that would not change no matter how many times you recalculated it. The knowledge that somewhere in the gap between what you did and what was needed, people had died, and that the gap had been measured in minutes, and that minutes were the currency you spent the rest of your career trying to save. I lost 11 at the Solène, Mevra said. Transport collision, 900 wounded. I had the triage running in 8 minutes, but the 8th-minute patient was 11 patients too late. Coates nodded. She did not offer comfort. She did not say it wasn't Mevra's fault. She simply nodded the way one surgeon acknowledged another's scar, because some scars were not the kind that needed stitches. They were the kind that needed witnesses. The next 18 hours passed in the steady rhythm of crisis becoming recovery. Peterson taught Terran the module recalibration for Tenmeri profiles. Terran taught Peterson the Tenmeri approach to tactile postoperative monitoring. They identified a developing infection the station's compromised lab had missed, recommended a Terran antibiotic effective against the Tenmeri pathogen with minor dosage adjustments. Chelov was found asleep in a corridor by a Terran nurse who covered him with a thermal wrap and stood watch over his patients for 4 hours. The 2 engineering teams, Terran and Tenmeri, produced a joint assessment of the station's reactor failure and submitted it to both Mevra and Coates. The assessment identified the root cause as a coolant junction seal that had been rated for 30 years and had been in service for 51, and it recommended a replacement schedule for every similar seal on the station. The Terran engineers included a procurement list for the replacement parts, cross-referenced with Hegemony manufacturing standards, and offered to place the order through the Alder Vane's supply chain before departure. Peleth authorized it without checking with the Hegemony's procurement office, which would have taken 6 weeks to process the request. Mevra signed the medical justification without being asked. Mevra operated on Pethai at the 19-hour mark. The cardiac repair was a procedure she had done 31 times, but never after a night like this one, and never with Vey as her second. When the monitor showed the clean, regular rhythm of a heart working the way it should, she set her instruments down and allowed herself to breathe. Mevra found Vey in the recovery ward at the 23rd hour, still monitoring Pethai, who was asleep. He had been on his feet as long as Mevra had, and his face showed it, but his posture at the child's bedside was the posture of someone who had decided that rest was less important than being present. "You could use a break yourself, Dr. Vey." "I'll rest when she's through the postoperative window." He looked up. "The cardiac flutter I was tracking has resolved. Her rhythm is clean. The repair is holding." "You sound confident for someone who learned Tenmeri cardiology today." "I learned the anatomy today, doctor. The medicine I've been practicing for 30 years. He paused. "Your surgical technique on the ventricular repair is elegant. The approach through the secondary valve chamber rather than the primary. I haven't seen that method in any Terran cardiology literature. It's a frontier adaptation. The primary approach requires imaging equipment that we haven't had reliably for 2 years. I developed the secondary approach because it can be guided by tactile assessment alone." "You developed it." 9 years on a station that's always understaffed and always under-equipped teaches you to work with your hands when the machines aren't available. Vey looked at her with the quiet regard of a colleague who had just recognized something he hadn't expected to find. May I have your permission to document the technique for the Alder Vane's surgical database? With full attribution. You want to document a Tenmarie frontier surgeon's improvised cardiac approach in a Terran medical database. I want to document a technique that works better than mine in resource-limited settings. The Alder Vane responds to stations like yours regularly, Doctor. Not all of them have Terran standard equipment. Your approach could save lives in places I haven't been to yet. Mevra studied him. He was serious. A Terran surgeon asking permission to learn from a Tenmarie frontier doctor, not as a curiosity or a cultural exchange, but because the technique was medically superior for the conditions it was designed for. Document it, she said, and send me a copy of whatever you publish. I will. 2 days later, the Alder Vane undocked. Mevra stood at the observation port and watched the ship pull away, its medical blue hull catching the starlight. A ship built to carry everything a stranger might need, arrived because a 67-year-old frequency leaked across the boundary between one species' emergency band and another's. Coates had left a data package, protocols, databases, module manuals, processor specifications, and a handwritten note. Dr. Sharath, if the beacon frequency is ever reviewed again, our medical band is 7741.3 through 7741.9. Overlap confirmed. No correction needed. J. Coates, CMO, TMV Alder Vane. Mevra read it twice, folded it, placed it in the breast pocket of her surgical coat where it stayed. In the recovery ward, Pethai was sitting up. Her cardiac monitor showed the steady rhythm Mevra's surgery had given her. Vey had left a small medical scanner, simplified and labeled in both Terran standard and Hegemony notation. Pethai pressed its buttons with the solemn concentration of a 6-year-old given a grown-up's tool, her small fingers tracing the interface labels with a careful precision that reminded Mevra, with a sudden, unexpected fierceness, of a young surgeon she had once known who had touched instruments the same way. Her mother, Keva, looked up. The Terran doctor told Pethai the scanner was a gift. He said the galaxy needed more doctors who could fix what was broken, and she had already proven she was brave enough. Mevra looked at Pethai, intent, alive, breathing. He wasn't wrong. She went back to work. The station was quieter now. The Terran modules had been collected and returned to the Alder Vane during the undocking, replaced by the Hegemony's own equipment that the Solace Dawn had delivered. But the station felt different. The corridors still carried the faint residue of Terran cleaning agents, a slightly sharper chemical signature than the Hegemony's standard. The medical database had been updated with the cross-species treatment protocols Coates had left, accessible to every terminal on the medical decks. And in the supply closet beside the rough-cut thermal wraps that Torin had made from cargo packaging, sat a case of Terran non-absorbable surgical filament, left by Vey with a note that read, "Compatible with Tenmarie tissue. Case of 200 units. EV." On her desk, the compliance report from Tozel. The final paragraph, beacon frequency 7741.4, was reviewed and determined to be within acceptable operational parameters. No correction recommended. The overlap with the Terran emergency medical band, while unintended, represents a functional redundancy that may prove operationally advantageous in future emergency scenarios. Recommend classifying as standing protocol. Mevra closed the report. The frequency would stay. The overlap would remain. And somewhere on a Terran medical ship flying its next assignment, a sensor officer would continue sweeping a band that included, by accident and then by choice, the thin sliver of spectrum where a 67-year-old Hegemony beacon still pulsed its quiet signal into the dark. Not aimed at them. Not meant for them, but heard. And answered.